I'm Barb Hickner with the Family Health Clinic. I am the Outreach and Enrollment Coordinator. For our 25th anniversary, we're interviewing staff and community members to explore what the Family Health Clinic means to them. In this video, we're interviewing Dr. Deep Battu from Valley Oaks. Dr. Battu, will you take a minute and introduce yourself, please?
Sure. So you already told everybody my name. Most people like to call me Dr. Deep because it's hard to pronounce my last name, but I'm working in collaboration with the Family Health Clinic to help out with the substance use population because there's so much addiction in Carroll County. So I come to the clinic about one time a week on Wednesdays for a set amount of time and try to do the best that we can to serve the population.
Great.
Oh, and I'm also the director at Valley Oaks Health. Sorry. That's my other day job.
So how have you seen the Family Health Clinic grow in the community since you first started being involved with us?
So what I've noticed while working at the health clinic is that they're always trying to find new ways in helping to serve the community. So since I've been working with the Family Health Clinic, I think for the past 2.5 years or so, I've noticed that there's multiple grants that they've applied for. So including the one that I sort of work on, which is assisting clients with getting on the addictions population, trying to get on MAT programs or Vivitrol injections to assist them with trying to reduce their drug use and eventually getting off of opiates and alcohol. Another grant I think that the Family Health Clinic has applied for while I've been here is having a social worker going into the schools to do school-based therapy, which is wonderful because it's very needed in the area. And then I know there's been smaller grants like getting funding from, I believe it's United Way, for like supplies and play therapy supplies and information education on addictions and whatever the behavioral health team might need in order to be successful in helping the people in our community.
So with that involvement that you have, what are some of the impacts that you have seen?
What I've seen is basically that the Family Health Clinic is always ready to engage in any changes that are coming in the community. Basically, if there's COVID that we're going through right now, or any emergencies, or if they find out that somebody in the community was in an accident or somebody needs help somewhere else, they're always willing and there to be in the front lines and engage and help the community out in whatever way possible. They collaborate with almost everybody in the community and are always available.
So what does being a part of the Family Health Clinic mean to you in your role with us?
So for me, it's been wonderful. When I come in, I feel really welcome and respected. I feel like it's very family oriented, like everybody takes care of one another. Everybody likes to see one another, engage with one another, and do little things that make other people smile. A lot of joking, and that's so nice because it's so comfortable to come in as an outsider and be part of the family. So very family oriented. People really, you can really tell that everybody that's involved, from nurse practitioner to you, Barb, to me as a psychologist, to the social workers, to support staff. Everybody cares about the client care. Everybody wants to see people do better. It's a very person-centered and strength-based approach or system, and it just, I'm proud that I work with you guys because you guys do such a great job. So I feel like I'm part of the team, even though I don't work for the health clinic full time.
Well, you definitely are. So what is one thing that you would like the community to know about the Family Health Clinic?
That they're always going to be there in the community. They're always going to be there. for you. If they don't have the availability or resources to help you, they will link you to what you need. And that's what's really important. Like they care, and they're gonna make it happen somehow or the other. And so I think that's really important. Like there's genuineness in the delivery of services that are provided at the family health clinic. And they're in everything. They have their hands in everything. And so that's really, really important. So, yeah.
Great. Well, Dr. D, thank you so much for your time this morning and especially your involvement with the Family Health Clinic.
You're welcome. It's been my pleasure.